Hello, friends. How are you all? Continuing with our mission of delivering information based on global scientific facts related to type 1 diabetes in an easy and interesting way, we are here once again today. Today's presentation is quite special for many reasons, because today we are going to talk about hypoglycemia, or hypo. Hypo is the most troubling short-term complication for families living with type 1. And perhaps that's why we have been requested by many families to discuss this topic. All activities in the child's daily routine, like eating, taking insulin, playing, and even during sleep, rarely go without the thought of a hypo coming to mind. After all, the effects of hypo can range from minor symptoms to severe brain damage. So if this is true, how can we alleviate our fear of hypo? Let's also learn some positive facts. Friends, what do you think, with proper information and caution about type 1, approximately what percentage of hypo episodes can be avoided? Almost 100%. Yes, you heard correctly. With proper knowledge and caution, almost all hypo episodes can be avoided. Scientific data shows that in the past few decades, the number of dangerous hypo episodes worldwide has been consistently declining. Even mild hypos are now seen less frequently than before. The widespread increase in diabetes education among families living with diabetes and the growing use of technology in type 1 care are considered reasons for this. But it is not enough to just overcome hypo. Along with prevention, timely recognition, immediate treatment, and appropriate preparation for it in any situation are equally important. In today's Who Will Be Type 1 Genius quiz show, there will be a mental duel on all facts related to hypo. Let's watch it for both information and fun.
Hello, namaskar, adab with a warm welcome and gratitude to all of you in this wonderful game, Who Will Be Type 1 Genius? Yes, today we will talk about hypo. And after watching today's episode, you will definitely say that you won't be afraid of hypo anymore. Let's welcome our first contestant, 16-year-old Orion. So let's play Who Will Be Type 1 Genius? Orion. Let's ask you the first question. Which of these symptoms indicates a lack of sugar in the brain? The options are shivering, sweating, hearing your heartbeat, or mumbling.
Sir, the symptoms seen in case of hypoglycemia can be divided based on two types of causes. Generally, the autonomic symptoms appear first, which occur due to the body's corrective reactions in a hypoglycemic state. But when blood sugar drops further, our brain functions start to be affected, which is a dangerous situation. In this case, neuroglycopenic symptoms like blurred vision problems, hearing difficulties, mumbling, weakness, confusion, and even fainting and seizures can be observed. So, the answer to your question is mumbling because all the rest are autonomic symptoms.
Very good, Arian. Both your answer and explanation are correct. Let's move on. You may know that blood sugar level typically below 70 milligrams percent is called hypo. If a child using a CGM shows a sugar level below 70 milligrams percent but has no symptoms, what would be appropriate to do among these options? Add 10 milligrams percent, ignore it, quickly confirm with a blood sugar test, or consider it as hypo.
In such a case, when hypo levels are shown on CGM, it should quickly be confirmed with a glucometer blood sugar reading, because sometimes there can be discrepancies between blood and CGM readings. But keep in mind, this should all happen quickly, and especially if hypo symptoms are present, treating the hypo should be prioritized.
Your answer is correct. Now, moving on to the third question. You have to tell at what blood sugar level is hypo considered serious. The options are 60, 50, 54, or 45.
Sir, this is a repeat question. You asked this in perfect sugar as well. The answer is 54 milligrams per deciliter. Below this level, symptom of sugar deficiency in the brain such as unconsciousness or seizures may appear. Therefore, it is essential to take it seriously under any circumstances, whether symptoms are visible or not.
Oh, you said it right. This question was also asked in perfect sugar. Actually, the questions are selected by the computer itself. I have noticed that the essential information is asked repeatedly. So, have you seen perfect sugar yourself, or sent it to any other type 1 family?
Sir, I have watched Perfect Sugar 7 times because the complete information given in it is not easily understood in one go. Each time I watch, I understand a couple of new things. I have sent all these videos to all my type 1 acquaintances so that they can also gain both entertainment and information from them.
Correctly said, Arian. In the next question, tell us which of the following statements is true regarding symptoms of hypoglycemia in children compared to adults. In children, sugar deficiency symptoms in the brain are less noticeable compared to autonomic signs. Behavioral symptoms like silence or irritability are more noticeable. Symptoms may appear at lower blood sugar levels, or children's symptoms are completely different from adults.
Sir, behavioral symptoms like silence or irritability are more common in children, so this option is appropriate. It is also observed that symptoms in children may appear at higher blood sugar levels compared to adults.
You are correct. In the fifth question, you need to tell which of these options does not have a higher than normal likelihood of causing hypoglycemia. Exercise, more fat in food, higher insulin dose, or sleep.
According to scientific facts, the body's corrective processes towards hypo can slow down during sleep. That's why monitoring sugar during sleep at night is advised. So, this won't be the right option. Sir, more fat shouldn't cause hypo. Lock this option.
Wow, your answer is absolutely correct.
Sir, apart from this, tight glycemic control or low HbA1c was previously considered a risk for hypo, but now with the use of new technology, it is not considered a risk factor.
You came well prepared. Arian, good. The next question is related to the use of CGM. According to CGM records, what is the maximum acceptable total time in a day for blood sugar can remain in hypo range? That is, less than 70 mg%. 1 hour, half an hour, 1.5 hours, or 3 hours.
Ideally, there should be no time spent in hypo, but during the day, it should not total more than 1 hour.
Correct answer. Very good. For the seventh question, tell us which statement is not true regarding the adverse effects of hypo on children's brains. The options are both low and high sugar levels affect the brain. Repeated hypo can impact the intellectual development of young children. The effect of a severe hypo can last until the next day, or there is no impact on the brain's structure from a hypo.
Sir, repeated hypo over a long period can also affect the brain structure. It has been observed. That's why this option is incorrect. Everything else seems fine.
Arian, through your answers, we're beginning to see a glimpse of our next type 1 genius. Sir, this is absolutely the correct answer. Aryan, in the next question, tell us what impacts can be observed in families living with type 1 due to the fear of hypos. The options are excessive anxiety, negligence in proper diet, increased HbA1c, or all of these options are correct.
Sir, according to modern information, the fear of hypo should be considered as a separate problem like hypo itself in families. After a severe hypo episode, it's observed that in the minds of family members, excessive fear of hypo sets in, and in constantly trying to avoid it, they completely disrupt glycemic control. Recognizing this situation is necessary for both families and healthcare workers. With accurate information and counseling, this can be managed. All the options you mentioned regarding this are correct.
You have passed this stage too. This is absolutely the correct answer. In the ninth question, tell us which of these options is good to check in case of frequent hypoglycemia. Thyroid disorder, wheat allergy, psychological conditions like depression or eating disorders, or all of these options are correct?
Sir, all these options can repeatedly cause hypos, but it is important to first follow basic information and precautions related to hypos.
Wow, your answer is absolutely correct. And now the final step of the 10th question has arrived. Our best wishes are with you, Arian. In the 10th question, tell us which of these options is not correct concerning hypoglycemia unawareness. This cannot be corrected after it occurs. It is seen more often with type 1 over time. It increases the risk of severe hypo. Or improvement can start to be seen if hypo is avoided for 3 weeks.
Sir, the answer should be either the first or the last options, because they both state opposite things.
You can take your time. Answer thoughtfully.
In my opinion, once it happens, it cannot be corrected. Sir, I feel the last option is incorrect. That should be the correct answer.
Are you sure? Shall we lock it?
Yes, sir.
Aryan, if you had chosen the first option, that would have been correct. Your answer is wrong. We are sorry that you reached the final stage but are not leaving as a winner. However, you played very well. Thank you.
Oh, poor Arian. But what can we do? A rule is a rule. Let's see what happens next.
Ladies and gentlemen, moving the game forward, we now call today's next contestant, Virat. Virat is also 16 years old and is a friend of our previous contestant, Aryan.
Sir, I am not only Aryan's friend, but also his disciple in diabetes education. I was detected with type 1 2 years after he was, and he guided me completely. If I win today, it will be a victory for both of us. In the neighborhood, everyone calls us Jai and Veeru.
Virat, I commend your friendship and thoughts. Let's start the game. In the first question, you need to tell which of these options may indicate a hypo occurring at night while sleeping. Having nightmares, finding low blood sugar on an empty stomach in the morning, feeling a heaviness in the head the next day, or all of these options are correct?
Sir, all these options may indicate the possibility of a hypo during sleep.
Correct answer. The next question is related to the treatment of hypo. Which of these items can be used for it? Glucose powder, sugar, honey, or fruit juice?
Sir, any of these can be used if needed, but glucose powder gives the best results. Also, keep in mind that the use of candy, cold drink, or fruit juice can create confusion between treat and treatment for children, so their use is not considered appropriate.
Your answer and explanation are both absolutely correct. In the third question, please tell how much glucose powder would be appropriate for immediate use in a 16-kilogram child in the event of hypoglycemia? The options are 5 grams, 2 grams, 8 grams, or 16 grams.
Sir, for the treatment of hypo, giving 0.3 grams of glucose per kilogram of body weight is appropriate. Accordingly, 5 grams or 1 tablespoon would be the correct answer.
Your answer is correct. In the next question, you need to state how much increase in blood sugar is expected approximately 15 minutes after the glucose powder dose given according to your previous answer. In milligrams percent, the options are 20, 40, 60, or 100.
Sir, the answer should be 40. It's important to test sugar 15 minutes after giving glucose, and if for any reason it falls into the hypo range again, the same glucose dose must be given again.
Virat, your friend Aryan has given you good diabetes education training. Your answer is also correct. In the fifth question, you have to state which of these options can be used for hypo treatment if needed. Chocolate, buffalo milk, Diet Coke, or none of these is appropriate?
Sir, none of these options is appropriate. The first 2 options and sweets made from condensed milk have high fat content, so blood sugar doesn't rise quickly, and Diet Coke contains no sugar.
Absolutely correct. You are playing well. In the next question, tell which option is wrong for children using insulin pumps in case of hypoglycemia. Should stop the pump for the next 6 hours. Stop the pump immediately if sugar shows less than 54 milligrams percent. Can restart the pump when it's above 70 milligrams percent. Or it is not always necessary to give 15 grams of carbs as a snack after hypo treatment.
Sir, the first option is wrong. All the others are correct, especially items like chapati, bread, milk given as a snack after glucose, which are necessary for children taking insulin injections, are not necessary for children using pumps if the sugar is stable.
Your answer is absolutely correct, Virat. In the seventh question, you have to tell what is not appropriate to do if a child has severe hypoglycemia and loses consciousness at home. Options are try to dissolve glucose in half a glass of water and make the child drink it. Lay the child on one side and make a thick paste with glucose powder and a few drops of water, applying it to the cheek that is facing the ground. If someone knows how to insert a nasal tube into the stomach, they can give a glucose solution or glucagon.
Sir, the first option is wrong. Trying to give something to an unconscious child can have fatal consequences. All other options are absolutely correct.
Your answer is also correct. In the next question, tell which feature of the insulin pump can help avoid hypo. The options are predictive low glucose management system, tandem basal IQ system, hybrid closed loop system, or all of these options are correct.
Sir, all these options are correct.
Correct answer. In the ninth question, you need to tell which option regarding the mini dose of glucagon given to prevent hypo in the case of inability to eat properly during illness or continuous vomiting and diarrhea is incorrect. It is administered using a 100-unit insulin syringe, given as 1 unit per year of age for children older than 2 years, and a 60 to 90 milligrams % increase in blood sugar can be observed half an hour after administration, or its maximum dose is up to 50 units.
Sir, 50 units are way too much. It should not be more than 15 units. This is the wrong option.
Wow, Virat. You have also reached the final stage of this game. You will have to answer carefully. Our best wishes are with you. Tell us in the 10th question which option is incorrect regarding the dose of glucagon used like a powder for the nose. The options are that it can be used for children over 4 years old. It shows an effect on blood sugar equivalent to a glucagon injection. Its dose is given according to body weight, or there is no need to measure its quantity before administering it in an emergency.
Sir, I did read this. I'll have to think a bit.
You can take your time. There is no rush.
I remember that the dose for children over 4 years old to adults is 3 milligrams, and it comes in a single-use pack of 3 milligrams. So, is it incorrect that the dose is based on weight?
Sir, you have to tell, not ask. Asking is our job.
Sir, lock this option.
Okay, Virat. You should have thought a little more. If you had said the last option, it would have been wrong. Your answer is absolutely correct. Congratulations on becoming our next Type 1 genius today.
Wow, today was a very interesting episode. Friends, there are now various types of glucagon available for use in hypo, which you need to be aware of. Their availability varies in different countries and regions. But with time, improvement is expected. We hope that after the information provided in this presentation, you will no longer fear it. In this series, we will return with the next episode. Meanwhile, to spread this initiative to everyone, make sure to share these videos with all beneficiaries, subscribe to the channel, and don't forget to share your feedback and suggestions through comments. See you soon. Take care. Bye.